Hi, I'm Dr. Carreen Pakrasi, Director of Ophthalmology at Medanta, Gurugram and Delhi. Today we are going to discuss diabetic retinopathy. I cannot cease to stress the importance of this topic. We in India have 50% of the load of diabetics in the world, and we're going to double before 2025. And so many of these patients don't know that they have diabetes, and when they have diabetes, they're diagnosed and they are not told that the eyes get affected. Your eyes will get affected by the diabetic process depending on your control, the duration, and whether you have any associated comorbidities like hyperlipidemia or hypertension. So what happens to a patient who has diabetes that affects the eyes? Many times you have heard this saying that the eyes are the vision to your soul. Well, maybe not your soul, but to your body. Because in the eye, we can see the blood vessels, and there is where the changes are taking place due to your diabetic process. You have to understand that your diabetes is about your blood sugar having an effect on the blood vessels, which then leak in various ways, giving rise to diabetic retinopathy. So who has to get checked? Everybody who has diabetes has to get checked. People with type 1 diabetes have to get checked immediately on diagnosis, and people who have type 2 diabetes have to get checked at least 5 years after they start the disease process, and then onwards every year. What are the symptoms of diabetic retinopathy? You may not know that you have diabetic retinopathy. People very often come to our clinic for a routine eye check, and when we check them, we find that they have changes in the retina, which is where the blood vessels are. And we say to them that, well, these are the changes that you have, where you have tiny little blood vessels which are growing in the retina, and they will increase with time if you don't do something. They don't even know that they have diabetes. Then we tell them to get their diabetes checked, and then they find out that they have high blood sugars. So a routine check for everybody after the age of 40 is very important to see any changes in the retina which can direct you to any other diseases in the body. Secondly, how do you treat it? It's very simple. As I said, that diabetic retinopathy depends on 3 things. Whether you have the condition for how many years, whether your diabetes is controlled, and whether you have any comorbidities. People who have hypertension along with diabetes will have more inclination to develop retinopathy. So we have to check you, and once we check you, we have to treat you. So what is the treatment? The treatment first and foremost starts with a regular check. So you must be checked regularly. Ask your diabetologist that, can I have my retina checked for diabetic retinopathy? Once you know that you have diabetes. When we see you in the clinic, we will dilate your pupils to check your retina, and if any changes are found, your diabetic retinopathy will be graded, and depending on the grade, we will ask you to follow up at different intervals. Sometimes people may even need to be seen every 3 months if they already have advanced changes. Once you have the changes, can they be treated? Yes, but first and foremost, your blood sugar levels are the biggest indicator, and you must control your blood sugar in order to control all the vascular changes that happen due to diabetes in your eye, in your kidney, and in your nerves. Once you get changes, then you may need lasers and you may need injections in the eye, but that is a very long discussion, and we can do that another time.